8日24时，
First of all,
国家卫
the
生健
latest
康委
numbers.
收到各省区市
From
累计
0
报告
to
确诊病例
24 of the
5974例，
the
现
National
有重症
Commission
病例
have received the following numbers.
1239例，
The total number is 5,975, among
累
which
计治愈出院
1,239 are severe cases and
现有疑似病例
132 deaths.
9239例， 累计
103
追踪到
discharged,
密切接触者
9,239
6537
suspected cases.
当日解除
People
医
of
学观
close
察
contact,
1604 有
65,537,
55990人正在
and
接受医学观察。
1,604
累计
are
收到
discharged
港澳
of
台地区
medical
通报
watch,
确诊病例
and
情况。
59,990 people are still under medical observation.
台湾地区
8
8例
cases in Hong Kong SAR, and 7 in Macau SAR, and 8 in Taiwan
本
region.
着坚定信心，同舟共济，
Prevention and control of the epidemic is
精
at a
准实施的要
critical
求，
stage,
我们正在全面
and
落实
we need
联
to
防联
pull
控
our
各
synergy
项工作
together
措施，
and exercise and
筑牢人民防
implement
线，
these targeted policies, and we are
紧紧
now
依靠
carrying
群众，
out joint
是我们
prevention and
一次又一
control
次
work.
成功应对重
People
大
is
传
the
染
one
病
that
的
we
宝
need
贵
to
经验。
rely on, and that's
一
the
分部署，
secret for
9
us
分落实。
to fight
当
and
前
win all of
社
the
区
battle
作为
against
社会治理的基
epidemics.
本单元，已成为控制
Implementation
疫情蔓延
is
的第一道
everything.
关口。
Community, as the
做好
basic
社区防
unit
控工作，
for
必须
social
充分发挥基层
administration,
组织
has
的动员能
become
力，
the front line of
执行网格
fighting
化管理，
this
地毯式追
epidemic.
踪，
So
国
at the
人到人，
grassroots
联系到户。
level, we have
不留
carried
死
out
角。
this
国家卫
grid
生健康委
administration
发布了公
and
众预防指
household
南，帮
administration
助群众
so
提
that
高
no
意识，
corner is
提高
left
能力，
behind.
加强自
The
我防
National
范，
Health Commission have
并且通过强化
published
人员健
this
康监测，
guidance for
密切接
public
触者
so
管理，
as to
预防
better
知识宣教，
help the public
有
and
效
our
遏
people
制疫情在社
to
区的传
strengthen
播。
their awareness and
下面，
self-protection
欢迎各位媒体
in
朋
order
友
to curb
进行提
the
问。
transmission of
提问前，
diseases at a
请通报以
community
下所
level.
在的新闻机
Now the
构。
floor is open to questions. Please identify yourself before asking the question.
好，请第一排这位女记者。
谢谢主持人，我是经济日报社记者，我想请教一下，就是因为春节假期临近结束，我们
With the
马上要
economic
返清朝
daily,
那么疫情存在
the
随
spring
时可能
festival
扩
is
散的
drawing
危
to
险，
a
我们有没有
close,
措施
and
来应对这一情况？
spring
然后
travel
另外我想请教一
will
下，
begin
有一
to
些没有
will
湖北或者是武汉接触史的
remerge, and we will have a
人员，
large number
从
of
外地返回
returnees.
驻地，
Do we have any
如果是
preparation
没
for
有
that?
存在发热的情况，是否需
Next
要隔离
question
观察？
is
能不能介绍
when
一下
those people
还有一些什么要
without
注意
a
的事
history
项？
of
谢
going
谢。
to Wuhan, and if they do not have a fever, do they also need to stay at home for medical observation and isolation? This question is why not Mr. Feng? You take it.
目前的各地有关部门呢，都和专业机构
In order to reduce that risk as soon
国
as
家
we
卫生
can,
健康委近日印发了一系
the
列
local governments have done a lot of work. The NHC have published a series of documents and guidance to strengthen work in this regard. The CDC also have compiled guidelines covering 6 common aspects of
疾病流行的
prevention
地区
control of the epidemic. We
从
suggest
这个离开
that
疫情流
in
行
the
地区的时间
prevalence
开始
and epicenter
连续
of
14
these
天
of
进
this
行自我的
epidemic,
健康状况的监测，每天呢要做2次。
and if you have traveled to the epicenter of this epidemic, you need to stay home for 14 days and check your body temperature twice a day and work closely with our community
条件允
workers
许时呢，尽
so
量
as
单
to
独居
report
住或者住
the
在同一
health
个
condition
房
in
间
a timely
尽量
manner.
减少与家人
If possible,
一起接触，
please
减少外出
reside
活动
alone
尤其是避免到人员密集的
and
地方
avoid close
了解
contact with your
反规避的
families
发热
and avoid
和
going
分布
out,
家庭医
especially
生
to
和社区医生保持联系。如果出
the
现了发
public
热、
places.
咳嗽、咽痛，
Understand well the location of the fever clinics. If symptoms were discovered, please go to the nearest a fever clinic to seek medical
第二
attention.
排的女记者。
你好， 好，北京日报社记者。请问一下，就是我们从之前武汉的那个发
With
布会上
Beijing
得知，
Daily,
有500万人在春节前离开了武汉。请问一下，
In
吴浩主任，
the
对您的社区有
Wuhan,
这样的情况吗？如果有的话，您怎么
press
做呢？谢
conference,
谢。
about 5 million people have left Wuhan. So, do you have any comment on that? So first of all, we have to make sure to put one thing clear: our enemy is the epidemic, is the virus, instead of people from Wuhan. We have to look at it from a reasonable perspective. Of course, we have returnees. And in my jurisdiction, that is Fangzhuang. So our community workers have been working closely to register this group of people, and they have stayed home for 14 days as required, as Mr. Feng have said. In Beijing, we also have this contracted administration that is led by the regional cadres, and at the street level and the community level, all of these cadres and officials participated at this time. During the quarantine time, the Community Service Center is in charge of helping them to address the basic needs, and the professionals also played an important role as family doctors. At Fengtai District and other places in Beijing, the families and the community administration are working closely together, as well as strengthening the connection with family doctors. We also need to use high tech to improve the efficiency in order to achieve scientific prevention control. Therefore, IT are widely used in this prevention control effort. So we recommend that people go online to seek help, to seek medical help. And we also have screened these patients, fever patients, into different categories, so as not to send all the fever patients to the hospital to avoid cross-infection. In this way, we can make sure that the returnees can seek grassroots medical attention at the very basic level at an early stage upon their arrival in Beijing. They can seek family doctors' help. They can seek the consultation at the community level, and we also have 24-hour hotlines ready to take questions. Take Fengtai District, for example. Through this our mobile application, we have processed more than 10,000 pieces of information, and 1.3 million person times information have been put into the system. So with such measures, these people can fully realize that in isolation and quarantine is a necessary step for effective control and prevention. So this isolation is for medical observation instead of an isolation of this person and or his connection with the outside world. He has to feel supported through our work. I completely agree. We have this kind of isolation in a physical sense, but not an emotional sense and at the community level.
谢谢，我是那个中央广播电视总台央视记者。这个问题呢，也是提给吴浩主任的，就是我们在一些这
With
个社交媒体
CMG
上
and
呢有报道发现，
CCTV,
就是有
this
多个地
question
方呢
also
会
is
出现有一
goes
些
to
群众呢
Mr.
不太
Wu.
配合我们的
On
这个
social
疫情的
media,
防控的工作，
we've
甚至
learned
呢会有一
that
些就是
some people are
遏
not
制工作人员
quite
的执法的这样的行为，
cooperative in
不知
terms
道
of
在您
prevention
的
and
在社区
control.
防控的工作中有没有碰到
Some
过类似的
even
情况？那
try
么现在在
to
疫情防控的一个关键的这个时期，
impede
您觉
get
得
in
我
the
们的社
way
区
of
医
the
务人
community
员和工
workers'
作人员呢，需要得
effort,
到大家
endeavor.
怎样的支持和
So,
配合？谢谢。
as medical workers at the community level and staff at the community level, how do we seek cooperation with the public? I think at an early stage of the epidemic, people had this kind of panic emotion. However, as time goes by, right now our citizens, our residents have a clear understanding of epidemic. So early detection, early isolation, and early treatment and diagnosis are the key to the treatment and control. So this kind of grid administration can effectively prevent the further spread of this disease. Our experiences are as follows. We have built a joint prevention control mechanism. First is the publicity of the knowledge of this novel coronavirus epidemic. So most of our residents are very cooperative because they are taking into consideration the future, a better life in the future. And also, this is category 1 epidemic. That's why a strict administration is the only way to prevent further spreading of this disease. So I hereby call on our residents to work closely with our communities. So our community workers also shoulder major responsibilities. We hope that our residents can understand our work so as to stand with us and realize this kind of group and collective control and prevention. Actually, a lot of the residents in my jurisdiction are highly cooperative. One of the Hubei returnee actually voluntarily called us to report his situation, and we exercised this quarantine with him, and after 14 days he has already been cleared. So we look forward for more cooperation on the side of our residents.
谢谢，我是路透社的。请问，社区应该采取限制人员流动的措施吗？
At the community level, will they be restricting the people's flow? I said, I have reiterated that this isolation, physical isolation, is not it's not the purpose, but it's a means to an end. It's a very effective methods.
我是来自人民日报的记者，我想提的问题是，我们看到一些报道在反映，目前有一些地区的社区卫生人员没有得到足够的培训，就直接硬着头皮进行这些防控工作。
Community medical staff are not well trained enough to carry out such work. So, what about this training situation for community level medical workers? The NHC have issued all kinds of guidance documents, treatment plan, control and prevention plan, emergency plan, and also the educational department of NHC have put on online courses for us to conduct this kind of training online. And in this way, the medical staff can take their training online in this specific model. Therefore, I believe that so far this training situation is quite satisfactory. We also carry out flight inspection to check if all those medical staff are qualified to conduct community work. Our regional leader also have pointed out that we have to strengthen self-protection and the learning of technical knowledge so as to make sure that none of the community workers and the medical workers will be infected. So this kind of training is highly necessary so as to realize collective prevention and control. Of course, we will continue to optimize our working mechanism and strengthen our capability in the process of solving problems.
谢谢主持人。中国卫生杂志提问，我这个问题想请问一下冯主任。前天发布的第4版
With China Health Magazine, the question goes to Mr. Feng. The fourth edition of Treatment and Diagnosis Plan, the general public are susceptible to this virus. Senior citizens in particular show more severe symptoms compared to the other age groups. So does that mean that old age and young generation and young people are susceptible or more vulnerable? Since the outbreak, experts in all places are speeding up their research, making plans for treatment and diagnosis. We do find some children's cases, but their syndrome are not as severe as the other age groups. The senior citizens are the age groups that suffer the most and show the most severe syndrome. Most of them have already got some kind of chronic diseases, so their risks of severe cases, severe condition of suffering from severe conditions or even death is substantially higher. So we need to strengthen protection in all age groups, especially for senior citizens and young children. So we suggest that senior citizens at this time should avoid going out to public and take public transportation vehicles. If you do have to go, make sure that you wear masks. For children, it's the same advice. If you have a family member that's suffering from respiratory infection, make sure that you protect your kids at this time.
谢谢主持人，我是新华社记者，想请问一下我们的冯主任，因为我们前2天发布的这个新型冠状病毒感染的肺炎预防指南里面说，我们要去乘坐交通工具啊，去医院、去公共场所都要配戴口罩。
stated that when you're taking public transport to go to the hospital, you have to wear masks. However, now more and more people are wearing masks. So, do you think that's really necessary that everybody that goes out are wearing masks? So will that constitute a pressure to the supply of the mask for the frontline medical workers.
大家都知道，就是直接照料。
If we are suggesting that people wear masks in order to reduce your risk of
那
infection.
么他们呢，要严格按照这个医院感染防护
But
要求
of course, the medical workers at the front line are the ones that is most exposed and with highest risk. They have to wear protection mask
其他的
and other protection
也
gears
应该有所
that
选择
meet
有
the
考虑
standard.
那么
For the
如果你要到公共场所乘坐
for the
交通
public,
工具，公共交通工具，这时候呢
if you're going to public
也建议戴上
places,
口罩。
take
如果你
public
个人独
transportation,
比如自己开车，
we suggest that you wear masks as
没
protection.
有特别
But if
密集的
you're on your
接
own,
触的这
for
样的
example,
情
if you're
况
driving
也
or
可以戴
taking
口
a
罩
stroll
因为这
in
样
the
情况
park,
它感染风险
and you do
没有
not
在
have
这
a lot of
这个
close
通过
contact
近距离
with
接触飞沫
people,
传播如
and
果没有这种
that
情形
will
其实
not
戴口罩
constitute a
是
very high risk for
我们
you.
这个口罩呢
So
尽量
in
当然
under
还有
those
还有一种情况就是我们
circumstances,
出现了
it is
发热呼
not
吸道
necessary
症
for
状
you
上
to
呼吸道感
wear
染的这个
masks.
人员，不管是居家在
And
自
of
由
course, if you're experiencing
还是到医院就诊
pneumonia
需要
syndromes,
交通工具
fever,
那这时候你
coughing,
要戴上口罩其他人呢
you have
可
to
以
wear
这个
masks
不必
during transportation as well as upon arrival at the hospital.
都佩戴口罩，对这个大家
For
应该有
the
这样的
other
风险
circumstances under people,
另外呢
it's
就是
not
公众佩戴
necessary
口罩
to
呢
wear masks
也
all
不
the
必
time.
随时换医务
For
人
the
员
public,
是严格的规定的使用多长时间就要
you
更
don't
换
have
口
to
罩
change
每
it
次进入
very
这个
often.
照料病人
For
和病人
medical
接触
workers,
进
there
入
are
医疗的
strict
所谓的
rules
误
for
区
you
污染区
to
那一定要一出来
change
就要把口罩
into
换
new
掉
masks.
再次进入呢要换新的口罩
We
这是
have
有规定的
pollution
而
zone,
且
that's
佩
the
戴口罩
red
的时
zone.
间
After
也
you
是有规定
exit the red
那
zone,
么
you
其他
have to
人员
change
呢
into
口
new
罩不
ones
是不必
before you
用一
continue
次
your
换一
work.
次用一次
And there is
换一
also
次可以
very
根
strict,
据它的这个清洁
very
程度
strict
可以使用
requirement for the time of use. And
时间
for
关
the
系，今
common
天的发布
people,
会呢就到此
it's
结束，
not
也再次谢谢
necessary to
中外媒体
change
的
the
记
mask
者朋友。
every time you go out. That's all for today's presser. Thank you all for joining us.